Next, we'll have Dr. Jamal from Carl Health going to present treatment of extracranial carotid artery aneurysm with flow diverter stents and coil embolization.
Hello, my name is Diverter. I'm one of the vascular surgery residents at Carl Foundation Hospital. Thank you for the opportunity to present an interesting case that we had of an extracranial carotid artery aneurysm. So we had a 40-year-old female who presented to our emergency department with left neck swelling, pain, hoarseness, odonophagia, dysphagia over the last 3 weeks. Initially, when she presented 3 weeks ago, she was diagnosed with parotitis and was treated with antibiotics, but due to persistent symptoms, she came back. Vitals and labs, as noted. An exam at this time showed a right neck mass, small pulsatile mass, left neck with a large pulsatile mass at the angle of the jaw. Imaging, don't know how to, if we can make it play, sorry. Oh, can you run it, please? Thank you. So this is the CTA that we obtained, head and neck. I'd like to draw your attention to the vocal cords. We'll see deviation on the left vocal cord due to mass effect from the left ICA pseudoaneurysm, and then the bilateral left and right, left greater than right aneurysm, and then the V3 ectasia that will be noted on there also. So, patient was admitted. She was starting an aspirin, hypertension control. Her medical history was significant for multiple miscarriages, so she underwent a hypercoagulability workup, which was negative, a connective tissue disease workup, which was negative. After discussion, based on how high up the left aneurysm was, we decided to go with an endovascular approach and got our neuro-IR colleagues involved too. She underwent an angiogram and then subsequent exclusion. So 2 pictures from the procedure. So initially, when we got our carotid angiogram, you could only see a little bit of the flow into the distal ICA due to compression from the pseudoaneurysm. So a precise stent was placed into the distal ICA to allow for ease of cannulation, after which then 2 flow diverter stents were placed extending down from the distal tip of the precise stent down into the more proximal ICA, and then the aneurysm was coil embolized to decrease flow and help with the thrombus formation in there. Post-op, patient did well. Her hoarseness, dysphagia, and odonophagia all improved. She did get an outpatient genetic workup, which showed a COL3A1 mutation concerning for vascular EDS. So, in terms of literature review, pretty uncommon. There was a recent multi-institutional international study that was looking at flow diversion for internal carotid aneurysms with neuro-ophthalmologic symptoms. They had about 55 patients that they looked at. 70% had complete thrombosis of their aneurysm after being treated endovascularly at a follow-up of 1 to 2 years for their patient group. So showing that it's a pretty durable option. So, questions at this time?
Thank you. So, while people are coming up to the microphones, what is your choice when you're thinking about these carotid aneurysms? How do you decide whether you're going to approach this from an open approach or an endovascular approach, since this is typically not the approach a lot of people here would obviously take?
So, I mean, the thing to weigh based on this, a couple of things. One is the distal extent of the aneurysm, how far up it extends. With this one being near up C1, it was more in the C2 region. That's why we kind of elected to give an endovascular approach. But I guess the question of being durability and long-term of the stent and having to go back and do something would be also something to weigh against that too.
Thank you.
Thank you.